Well, good afternoon. I see a lot of familiar faces. I'm going to start here, but I just tend to move, so I don't know if I can stay behind the podium or not. As Andrea said, my name is Kelly Price. I'm the Manager of Employee Wellness and Community Health here at Baptist Easley. I have been at the hospital. Last week was my 15th year, so I have really truly grown up here. And some of what I'm going to talk to you today, Andrea and I had talked recently, and she invited me to come, and my passion has been and continues to be around heart disease. When I first came to Baptist Easley, I started out in cardiac rehab, and I worked in there for 10 years and managed some of our cardiopulmonary departments, including our EEG and sleep lab. And so I've just always worked with patients who have recovered from heart disease. And now the last 5 years, I've been able to take all that knowledge and be able to share that with our employees, because as healthcare workers, we take care of the patients all the time. So we're giving and taking care of others, and we're really bad to not take care of ourselves. So that's how our employee wellness program came about, is we realized as a hospital that, you know what, we have a lot of employees here and they're not a healthy population. So we started being able to offer education, exercise programs, assistance with their medications, things that we do for our patients. We started offering to our nurses, our doctors, our employees, so that we could get them healthier as well. So all that to say, that's kind of how my last 15 years have been. I'm happily married to my husband, Brad, and he leads worship at our church. We're both from Walhalla, so we're over in Oconee County, and we have one daughter who is 10 years old and the love of our life, and she's going to be a fifth grader. We're already finished with school, so now we're a fifth grader. So when I'm not at work, those two are my passion, and it's what I do outside of here. So what we're going to talk about over the next few minutes is risk factors for heart disease. As I mentioned, heart disease has been my passion, and it goes along with wellness because even if you haven't had a heart attack, there's things that you need to know now and that you can do to prevent that. So we're going to go through this, and I have a little exciting thing to do towards the end. So let's start about talking about risk factors that we can't do anything about, okay? And I'm going to have some audience participation. I know you just had lunch, so just to keep you involved. One of the very first things is that puts you at risk for heart disease is gender. And just by default, males in the room, you are at a higher risk of developing heart disease, okay? If you've ever, how many of you have heard of the Go Red for Women heart disease, the red dress campaign? You've heard that over the years? Well, that came about because in the late 80s, there was women, they were doing, we always do research so that we can improve our health. There was research done showing that there was more women, more females dying of heart attacks than males. So the Red Dress campaign was to bring an awareness to, yes, more males, are at risk for heart attacks, but that we need to pay attention to the females as well. So that's where that campaign came from, just to bring more education from American Heart Association and awareness to the females as well. So it wasn't just, oh, well, you're a female, you're not at risk, and move on. So really just in the last few years has that became more prominent. Why did more females, why were they, more of them dying from a heart attack? Is because our symptoms, and we're going to talk about that a little bit more, but our symptoms were a little bit less. Females don't tend to always, now I'm not saying that it won't happen, but usually, typically don't always have maybe the same symptoms that a male would have. So fatigue back years ago wasn't something that they were considering could have been a symptom or a warning sign for heart disease. And so a lot of females, by the time they found out that they had heart disease, they had already died and gone. So fatigue, women, we just say, oh, we're tired, we're fine, and keep on going and just kind of push it under the rug. So that's why they've brought campaigns out, whether it be for cancer, heart disease, or different things. It's just to bring awareness. Same thing as my role here with the employees and in the community is that truly healthcare has changed to trying to keep people out of the hospital and go out into the community to bring awareness to your health and the risk factors that you have. So gender being the first thing. The second thing is age. When for males, you become more at risk for having a heart attack or developing heart disease at age 45 and higher. So just what I like to think about, if you're going through a little checklist in your mind as we go today, think, all right, as she's saying these things, what applies to me that I need to, be more aware of? So males for age 45 and greater. Females, when you reach age 55 and greater, and that's typically around, menopause, and that affects that. So that's why it's a little bit higher for females. So we've got age, we've got gender, and then lastly, family history. So how many in here can say that you have a father or a mother or brother or sister, at least in your family, that has been affected by heart attack or stroke or some form of heart disease? Lots of hands, at least at every table, several of you, including myself. So I say all that to say that those are things that you can't change. I mean, we're getting older, and we want every birthday. I had one yesterday, and so we want to celebrate those birthdays. So we want that age, but we just need to be more aware as we do get older that we may become more at risk for things. Family history. When we go to the doctors, they ask us everything. Sometimes you think, okay, I know what they're going to ask. Yes, you allergic to latex? No, go down through there. But truly, they are asking about your history so that they can know when you present whatever symptoms you may be having, then they can, rule out, well, you're more at risk or this is your age. So the doctors are looking at all that. So making sure that you're aware of your family history. I actually went to the doctor last summer and was asked a question and had to call my mom is deceased, so I had to call my Nana to say, hey, do we have family history of X, Y, and Z, and find that out. So because the doctor was going to order some tests, but if I wasn't at risk for them or didn't have a strong family history, then it wasn't going to be as necessary. So it truly can help, not only save your life, but may help the doctor be able to determine and diagnose. So those are three things, not a lot we can do about, that are put you at more risk. Gender, age, family history. All right, back to our hand raising. How many in the room, if you want to share, have either you or let's just go with you, have a history of high blood pressure? Maybe yourself or someone in your family, even if you haven't been affected. So you can kind of look around. Not quite, probably half at least. So we've heard it known as hypertension or high blood pressure is what we like to use around here. Is that can put you more at risk for heart disease, okay, or heart attack. And I say heart disease because it's more, your heart can be affected more than just by a heart attack. But having high blood pressure, making sure, and you'll hear me say this over and over today, is making sure that you're aware. You're aware of your family history and all those things that we discussed. Also, making sure that you go to the doctor on a regular basis, or that you're having, your tests all checked routinely and even annually or however often you need to. So knowing that, what is your blood pressure? And Andrea has handed out some flyers that you've probably heard about maybe before, maybe today you haven't, but we have a clinic right across the street. We call it Be Well Thursday, and we have several tests that we do there for free. Blood pressure checks are one of those. You can come by any Thursday morning and we can check your blood pressure for free. I know I was sitting at the YMCA in Pickens last Saturday. They had a blood pressure machine there. People were working out and they were checking their blood pressure. And a lot of the CVS's and pharmacies have them as well. But just if you want a nurse to check yours, without having to go to the doctor. You can come by our clinic. We'll do that for free every Thursday morning. We have some other tests listed there as well that you can take with you. But knowing if you have a family history of high blood pressure, and then knowing what, I like to usually do a presentation called Know Your Numbers. You know, what is your blood pressure? And you know, if it's running too high or too low. And if your doctor is treating you for the blood pressure, making sure that you keep a record of what your blood pressure runs, so that, because we know it fluctuates mornings, evenings, sometimes based on what you eat. So that way you can show the doctor what it is. We have an employee here that we have to do our annual blood pressure and lab work done for our insurance, and she truly has white coat syndrome. So she would come upstairs, her blood pressure would be out the roof. We'd send her back to her desk, you know, and then I got to, I started going to her. That way I would just drop in and say, oh, hey, I'm going to check your blood pressure. It would be a world of difference. And it was just that dreading of, oh, I've got to go do this and, you know, come see us. So just that's why it's always good to just check it, you know, at different times, and that way you can kind of give the doctor an idea of how it's running. And if the doctor prescribes medications, making sure that you take them. So you'll hear me say, make sure that you know what your numbers are and take the medications as prescribed. That way you can, you know, make sure you regulate it. Yes, ma'am.
How important is it to check the pressure in both arms?
Both arms, typically they check it in the left arm, but they can differ. I know in cardiac rehab, when we had a consult come in, we would always check them in each arm to see if there was a difference, and we typically go with the higher reading. But just, you know, discuss that with the physician. So good question. So blood pressure, different things can affect blood pressure. It being higher, definitely, like as we mentioned, family history, activities that you do. Some may be affected by the amount of salt or sodium that you eat, but just knowing what your blood pressure is and making sure that you follow up and review that with your doctor, and knowing that if you do are, you know, diagnosed with hypertension or high blood pressure, that can put you a little bit at a greater risk for developing heart problems. All right, let's move on to high cholesterol. How many of you may have been diagnosed with high cholesterol, or maybe a spouse or a family member? Yep, so about the same. Pickens County is actually, we rank very high. You know, usually you want awards, but this is not one that we're necessarily proud of. But I work with our Pickens County. We do a community health needs assessment where we go out and survey thousands all across Pickens County, and it's not everyone, but we go out and we use that report. We work with Canon and use that report to see what it is that the community thinks that we need to improve on, and then truly what the health outcomes are, and all different ways that is tested and looked at. But Pickens County is ranked one of the highest in the state of South Carolina for high blood pressure or heart disease, and for diabetes. And then South Carolina, because we're right down here in the southern states with our lovely fried chicken and fried everything, we are ranked one of the highest in the nation as well for our rankings in heart disease and in diabetes. So that's why it's just very important that we bring awareness and make sure that we can catch it early enough. So high cholesterol, again, knowing what your cholesterol is. I'm not going to plug our Be Well Thursday every time, but again, that's something that we do check. Things that we check at Be Well, you don't have to have a physician's order. So we can check your cholesterol without having a doctor's order, and then you can take those results, or if it's anything very high, we will contact your doctor for you. But again, you can have those checked at your physician's office. Typically, they check it once a year. Depending on if you're on medications, they may check it every 3 to 6 months. But knowing what your cholesterol is, again, it can be affected by family history. Myself included, I don't have a history of high blood pressure. My cholesterol is borderline of my bad cholesterol has creeped up over the years, and I am very avid in exercise. I truly try to watch everything I eat. But I have a dad who is in his late 50s on cholesterol medicine, and I have grandparents that are. So I know that family history, that just puts me at a higher risk. No matter what I do, I still need to be conscious that, you know, my cholesterol, that I'm at a higher risk of it, and that is why it's moves up. This last year, actually last summer when we did our annual screenings, it was actually the lowest it had been. Had not changed anything about my diet, but increased my activity tremendously, and was able to see a positive result in that number come down. And I get to see that a lot with our employees, with our heart patients that we've had over the years, that when you start increasing that activity and kind of being more conscious of what your foods you're eating, then you can see those positive results. So knowing that cholesterol is another risk factor. All right, next, diabetes. Any diabetics? Little less hands going up, or maybe how about family history of diabetes? And some more? Yep, there we go. So diabetes, being a diabetic, can put you at a greater risk. Not saying that you're going to have a heart attack. Remember, we're just talking about what increases your risk for heart disease. Blood pressure, high cholesterol, being a diabetic as well. And I think Andrea in the next few months has our diabetes educator, Liz Stokes. Hopefully that will come present to you and share with you about our diabetes program and some education around that as well. Remember, I said diabetes is one of the higher things that Pickens County is ranked for in the state and in the nation. So knowing what your glucose is, that's a screening that we can do. Your hemoglobin A1C, it gives more of a number to help you know, a higher screening to give you an average over the last few months to know what your blood sugar runs, because it can fluctuate just as well as your blood pressure. You might check your blood sugar today, it may be different this afternoon, it could be different in the morning, but if you do the hemoglobin A1C, it gives you the average of what it's ran over several months. Those tests can be done at your doctor, simple finger prick, as well as can be done at our local screenings, including ours. So knowing if you're diabetic, if you've been diagnosed, again, so important that you take the medications as the doctors have prescribed, and that you follow up and do everything as prescribed. So it's making sure that you take care of yourself. The next one I have listed is tobacco use. So using tobacco, and I say tobacco rather than just smoking because of the nicotine that's in all the different products of chewing tobacco. But if you have a history of tobacco use or are currently smoking, that definitely can put you at a higher risk for heart disease. So very simple answer is what? Quit. Quit or never begin. And I take a very simplified version of this, very, very simplified, and I love to go any chance I get to talk to children, because so many people that I've came through our tobacco class, I had one recently of one of our employees who was trying to quit, and she said that she started at age 14, and has been smoking that long. So, and now, tobacco's always been accessible, but even now it's very, very, very good to educate our young children in the schools, and especially, not just on tobacco, but on nutrition and everything, because the healthy or non-healthy habits that we create as a child carry on as we get older. So not ever starting to use tobacco or quitting. And the next one is obesity. We go back to knowing your numbers, cholesterol and blood pressure, your glucose, but your weight as well. So obesity has risen across America over the last decade. The last numbers that I saw was we had about 68% of America was obese, not just overweight, but obese, which leads me into one of my most passionate topics, and I probably, if I had to pick a favorite risk factor to talk about, it would be physical inactivity. And I just think you can't talk about obesity without talking about activity as well. So being sedentary, or just putting it out there as not exercising on a regular basis, it's not healthy for you. It can lead to being overweight or obese, and then it can definitely connects to all the things that we've talked about. Like I mentioned, I've been here 15 years, so when I first came out of school and was doing research, working with the American Heart Association, they recommended that you exercise 3 to 5 days a week. So that would be what I would tell heart patients. If you could get, or anybody, if you could get 3 days in, maybe at 20 minutes, then that's good. That's what we consider you're an exerciser, or you're being physically active. Now, if you go to the look at All American Heart, it's most days a week. Most as in 6 or 7 days a week, and it is recommended 60 minutes, an hour a day, If you're really wanting to lose weight, 90 minutes a day. Now that can be broken up all throughout the day, but as obesity has increased and all of the things that we do have become more electronic, then we have to do more. 5 years ago, I was working in cardiac rehab. I stood on my feet all day long, worked, with patients, walked around. I never sat down that much. Moved upstairs to employee wellness, sat at a desk all day. Never changed one thing what I ate. I'm very strict about what I put in my mouth. Never changed it. 10 pounds in 3 months. Only thing I changed was standing on my feet 12 hours a day doing patient care to a desk job. It's the only thing I changed. So then I had to say, whoa, what's going on? What happened? And then I had to start getting up early, before I come to work and doing extra on the treadmill or making sure that I worked out more days a week, just because it's a matter of changing my routine, not changing what I eat, but I was less active. So that was an eye-opener for me, and it's actually helped me be able to talk to people, especially our employees, that sit all day, that we take that for granted. One of my favorite things that have been created is now your phone, or you can get Fitbits or, bracelets or different things that tell you how many steps you take. And it just, after a while, I had worn mine for over a year, but after a while you get in the routine of it. You park further away if you can, and you just take the stairs if you can over the elevator. You just start doing more things. So it's not necessarily that you have to go join a gym or do anything like that. You can just start being more mindful of things that you do at home and how you sit. So being, the stronger we are, when I talk, if I was just to speak about high blood pressure or high cholesterol, what I would say, or diabetes, is I would say take your medicines as prescribed. I truly believe in that. Work with your doctor before just changing your medicines on your own. Make sure you eat a healthy, balanced diet. Andrea knows that I don't promote, low carb or this or that. I'm not a dietitian, but I've worked with them very closely and seen it over the years, that just a healthy, well-balanced diet. The food pyramid is there for a reason, that we need all those foods. But making sure they're healthy, making sure it's the proportioned right, so making sure you watch your diet on your intake, and being physically active. Being exercise, if you look at, how do I improve my blood pressure? It's watching your diet, avoiding salt, and exercise. Taking your medications as prescribed. Those several things are listed for high blood pressure, for cholesterol, for diabetes. All of those are treatments and how to lower those things. Exercise can help increase your good cholesterol, help lower your bad cholesterol, helps lower triglycerides, your glucose, and all of those things. If you went upstairs to see our diabetes educator, she's going to not only talk about, your sugars and your carbs and how to watch this and that, but she's going to say, and how active are you? What are you doing for exercise? So I really want to leave that with you today is, making sure that you're aware of everything, your family history, making sure that you know that things lead to putting you at more risk for cancer or for heart disease or other diseases. And a lot of it we can change. We can take care of our bodies by prevention, by doing the exercise, drinking your water, taking your medications, and again, just being aware and making sure that you communicate with your physician, and making sure that you even have a physician and that you're going on a regular basis so you can know what to do. So what we're going to do over the next few minutes is I want everybody to sit up tall in their chair. And I'm going to finally come out in front of this podium. And Andrea didn't tell you, we're going to have a little active food for your thoughts today. Can't talk about exercise without doing some. One of the things that I'm able to teach along with some of our nurses upstairs, and we have another plug for you, we have our arthritis exercise class. We currently offer it twice a year here at the hospital, but we're increasing that to 3 times a year because we've had so many people enjoy it. But we meet twice a week. It's for an hour. You can dress however you want to, but it's a lot of chair exercises. We do some things standing up, but it's very helpful to help you become a little stronger and more flexible. And I see some familiar faces of people who came to the class. But we do offer that as well as a chronic disease class that is an educational class. If you're dealing with heart disease, diabetes, cancer, maybe you're even a caregiver for others, or any other chronic condition that you have. It may just be blood pressure or cholesterol. Then we have an educational class that we offer several times a year too to help you manage that. So we have some flyers for you to take with you today, but just trying to help you putting those plugs in so you know that we do offer things for our community, and most of our classes, including tobacco cessation, are for free. So just some resources that you can find. All right, so we're going to sit up tall. I want everybody to take a deep breath in through your nose. Out, exhale out your mouth. In through your nose. And exhale out your mouth. Good. Do that a couple more times. One thing I didn't mention today is stress and how often stress plays a toll on our body. It can actually, we get stressed because we don't feel good, we can't move, or just life things in general may stress us out, and that can play a toll on our blood pressure and the way our body responds too. Exercise and activity can actually help relieve stress. I don't know how I would get through every day if I physically couldn't move and exercise, and it helps me just wind down. So just that simple breathing technique can just kind of center you and bring you and just give you that extra breath, and then can move on. All right, so I want you to take your arms down by your side. We're going to lift your shoulders up, down, up. Just keep doing that for a few times. One of the things you could do, these are some things you can do at home just to keep moving. Again, you don't have to join a gym, but right now, if this seems like really easy and you're thinking, I could do more than this, imagine if you were holding some soup cans in your hand, okay? So that would put a little weight on each side of you. All right, now turn your hands this way. Can everybody see me? All right, we're going to curl up to our shoulders and down, up. For some of you, this may be more movement than you actually are getting on a daily basis. For some, again, you could hold soup cans in your hands just like this, and this is actually working your bicep muscle, and it's giving you some strength exercises, as well as just, if you do it long enough or do it even at a faster rate, it's going to increase your heart rate a little bit, get the blood flowing. Try not to touch my microphone as we do this. All right, good. Hands down. All right, now I'm going to take your shoulders, go up and back. Up and back. Oh, I hear that hurts, and some cracking and popping. And remember, you're the machine, so you can control it. You can do it nice and up and back, and do it nice and slow, just kind of as a stretch. Or you can go faster, if you're wanting to increase your heart rate a little bit, get your pulse up, you can do it at a faster rate. All right, you can pause. I want you to take your right ear and just drop it over to your shoulder and just hold it. This is something you could even do just sitting, watching TV, or take a break from reading and sit there. Make sure you breathe. It's very common. Don't want to hold your breath. Ah, there you go. I knew. All right, come up. Slowly go to the other side. These are some things I try to teach the employees too when they're sitting at their desk, just to do throughout the day.
Don't hold your phone under your ear.
Yeah. All right, come back up. Now I want you to take and look over your right shoulder. This is one that we do almost every arthritis class to start it off. Because what movement would you use this for? All right, you can come to the front. Now look over your... Yes, see if a car is coming. We all want to be able to do this movement and stay flexible in our neck. Okay, come back to the front. Good. And you want to move slow. All right, I'm standing, but you're sitting. But just lift your legs slowly up and down like a marching position. And again, these seem like really simple movements. With our arthritis class, we have there's over 120 types of arthritis diseases out there, but we have hundreds of different exercises that we teach, and these are just a few of them just to give you an idea. But you don't have to have arthritis to do these things, but these are just some simple things that, it's too hot outside, I can't go outside and walk. I don't want to drive over to the impact center or to the Y, or I don't want to join anywhere, and it's too cold, I can't go outside. We make all different reasons of why we can't do things, but sometimes simply coming here, walking inside the hospital, you can do laps, okay, you can rest. All right, now take one leg out in front and just roll your ankle in circles. Just turn your circles. Good. You can go in and out. You can go to the mall, you can come to the hospital and walk. Of course, there's all kind of tracks all over Pickens County and the Doodle Trail, but you can simply, I have several ladies over the years, okay, switch, that had came through rehab that would set the timer on their microwave, and they would just get up and walk through the house, 5-10 minutes at a time, several times throughout the day, or do some exercises. Just anything to add more activity to your daily life to help you be able to do the normal daily functions as you get older. Good. All right, take your hands, same thing, just roll your wrists around. Might even notice as you do this, you might be a little stiff. All right, take your arms out, take a deep breath in, blow it out, deep breath in, pat yourself on the back. Good job. Good job. Just a few simple exercises to end our little time together. Does anybody have any questions? Oh, yes.
What causes low blood pressure?
Low blood pressure, it could be caused several different things. Medications can definitely lower your blood pressure. Then we had an employee come in yesterday who had low blood pressure and doesn't take any medications. A lot of times your top athletes, like marathon runners and some of those, I don't know if you fall into that category, but some of those very high athletes, they actually have low pressure too. But the first thing I would do, one is discuss with your doctor, and a lot of times is to, that they would review your medications. Dehydration, certain things like that could cause it as well.
Dehydration, flying on airplanes, right?
Yeah. Yeah. So lots of many different reasons, but and sometimes people have lower blood pressure and they never know it, never affected by it. So always, make sure you talk to your doctor, and if you have any symptoms that may go along with it, any dizziness or fatigue or, extra tiredness or anything like that.
I have a sister that has had open heart surgery, and she also has very high blood pressure. And she tells me, which I don't believe in the first place, that her doctor told her not to do any exercise. And of course, she's quite obese. And I keep saying, I don't believe your doctor said that. So my brother says, she only hears what she wants to hear.
Most people do. Most people do. But with that said, we couldn't be medical without putting our clearance in there that if you aren't exercising and you're interested in starting an exercise program, always talking to the doctor first, is very important too, just to make sure there's no limitations and that they know. So thank you very much for having me.